I'm thrilled to be introducing Dr. Al Freedman of Westchester, Pennsylvania, a father of two who works as a psychologist specializing in the area of rare disease and disability through Freedman Counseling Associates. Are the proud parents of two children, Kara, 21, and Jack, 26, who was diagnosed with SMA, or Spinal Muscular Atrophy, a rare neuromuscular disorder that results in the loss of motor neurons and progressive muscle wasting. Sadly, very sadly, Jack passed away this past October at age 26. Al, thank you for taking the time to be part of the Special Fathers Network, Dad's virtual conference, and for sharing some thoughts about the topic about combating depression and helping support the emotional needs of both parents as well as children. So what I think makes you uniquely qualified to talk to the topic is that you've had your own personal experience as the father of a child with severe special needs, and you do this professionally, right? You've consulted with thousands and thousands of individuals over your decades-long career. So the first thought, and I'm just approaching this as a layperson, is the idea of diagnosed and undiagnosed comes to mind. And I'm wondering if you can give our guests an understanding about what the, I guess, clinical definition of depression is, just as a baseline.
Well, there are different flavors of depression, just as there are different flavors of ice cream. Depression can be a pretty serious impediment to living a life of quality. And depression can be very debilitating to people who are genetically vulnerable to depression based on genetic transmission and family history, and or a person who experiences a significant stressor in their life, one of which is having a child diagnosed with a complicated special need. Diagnosed and undiagnosed, to me, when I hear that question, it has to do with have you consulted with a professional to get a formal diagnosis? And as a practitioner, what I'm listening up for are symptoms, the severity of symptoms, duration of symptoms, frequency of symptoms, intensity of symptoms, and are the symptoms of depression interfering? To what degree are symptoms interfering with a person's day-to-day functioning? When symptoms interfere with a person's day-to-day functioning, whether it's sadness, loss of interest in activities that you typically enjoy, crying, thinking about death, thinking about suicide, sleep disruption, appetite disruption. These are the clinical, to answer your question, the clinical symptoms of depression. And again, you can have a little of it, you can have a lot of it. You can have it for a short time, you can have it for a longer time. You can have a mild version of depression that's chronic and persists. You can have situational depression that paralyzes a person and then passes. So there's no one type of depression that people experience, and there's so many variations of it that it would take a lot longer than we have now to go through them all.
Well, thanks for putting a framework to the concept of depression, which I think of as diagnosed and undiagnosed. And if I can paraphrase what you've said, it can only be diagnosed if you're consulting with a professional. Many people who are experiencing depression, I guess, by definition, would be undiagnosed officially, even though they might identify with many of the symptoms that you just made reference to. So let's start with our limited time to talk from a dad's perspective about dealing with his own depression. And I'd like you to reflect personally first about your experience with depression as it relates to the diagnosis that you received when Jack was very young, and then what's transpired subsequently.
Sure. Well, in my own case, my baby Jack was born way back in 1995, and he was born healthy. And it wasn't until his 6-month pediatrician checkup that we became aware that there was something different about baby Jack. And at that 6-month pediatrician appointment, the doctor noticed that Jack wasn't sitting up and rolling over like babies typically do. And that led to a referral to a pediatric neurologist that led to a diagnosis just 4 days after that pediatrician's check-in appointment, fairly innocuous appointment usually. 4 days later, we were told baby Jack had an incurable, untreatable neuromuscular disease called spinal muscular atrophy, and that he would live only a year from that time. So that news shook our family's world to its core, and nothing felt safe for a while. It was, I best describe it as a trauma, a trauma. Everything that we thought was true went out the window. And instead, we went from having a healthy baby, firstborn, a healthy baby, to having a baby that wasn't going to live more than a year, all of a sudden. So that brought on a lot of fear, a lot of shock. I call it a disorientation. I was disoriented for a period of time. And as I said, things didn't feel safe. I found myself waiting for the next big problem to happen. If that could happen, anything could happen. So my mind kind of played tricks on me, which is a common thing that I hear as a professional from other families who have this experience of a trauma through a diagnosis. I was driving 40 miles an hour in the right lane of the highway, assuming I'd get in an accident if I drove too fast. I was afraid in the winter time to light the fireplace in the house where we were living, assuming I'd burn the house down. A few years later, when we adopted our daughter, baby Kara from Korea, I didn't believe she'd walk until she walked and kept walking because Jack never walked. Well, the first baby didn't walk. Why would the second? So your mind plays tricks on you in ways that are unusual in response to such an unusual series of stressors. And then for me anyway, as a dad, the trauma settled down after a few weeks, couple months, and I steadied myself, having reoriented to a new world that I had been launched into. I called it being launched into the twilight zone. Another experience you have is isolation, which can lead to depression. When you're launched into the twilight zone, having this kind of diagnosis, there's nobody else there with you. So nobody else can really understand you until you meet other parents who have also been launched into the twilight zone. That helped me significantly to reorient. And then with the reorientation, my appetite and my sleep patterns settled down, and I was able to carry on my life and Jack's. It took time, and I needed to follow Jack's lead because he was still a very happy baby. He wasn't concerned about anything. So following his lead also was very helpful. But it was overall a very traumatic period of time that I'll never forget. It was election day. So every election day it comes back. And I remember on election day, after we came out of the children's hospital with this news, I remember wondering why everybody was going about their business. There were people lined up at the polls in Philadelphia, and I wondered how could they be just lining up to vote on a day like this? The world kept on going, but ours just stopped. So it was confusing as well. So that was like being launched into the twilight zone and looking back at the earth that I had begun the day and not understanding why the people there were still carrying on the way they were. It was a disorienting experience in the beginning. That's 1995 we're talking about.
So that was the beginning, right? You had to reorient it yourself. That's what I heard you saying. And, you had this fear that Jack would only live another year. A year goes by, a couple of years goes by, and he's still here. And he's a happy baby, right? And he's growing and developing. But he's experiencing some of the symptoms that go along with SMA. And I'm wondering how that transpired as well. And how did you and your wife, deal with the year to year, not knowing, what was around the corner?
Yeah, thank you, David. So, well, first, I wouldn't call it a fear that Jack would live a year. At that time, it felt like a fact because we didn't know anything about this disease, and the doctors did. So we believed what the doctors told us, and the doctors had seen babies who were as weak as Jack not live past a year from the time they were diagnosed. So we were going with that as the truth and the fact, and there was nothing we could do about it. Jack didn't cooperate with that prognosis for a long time, and when he had his birthday party, his first birthday party, year one, first birthday, we thought that would be the last birthday party he'd have, and then he had a second birthday and a third birthday, and we realized that he wasn't cooperating with that prognosis, and he was happy. Yes, many symptoms. And by the time he was 3 or 4 years old, we'd already lived in the hospital for 50 or 60 nights in intensive care because he got really sick. And he had a little wheelchair. He was driving a little power chair before he was 3 and a feeding tube. And he needed to breathe with the help of a ventilator and a mask, a BiPAP mask, by the time he was 2 or 3. So the house quickly became like a mini hospital at home with lots of medical equipment and people in and out of the house helping us. And what happened during that period of time was that Jack was so happy, spirited little boy who never complained about anything and was so grateful for every day and grateful for all the people in his life and grateful just to get out and about and be in the community and be with friends. And then ultimately, he attended school, not until about 4th grade because the doctors didn't think he'd survive the illnesses he'd catch with younger kids sneezing and coughing in kindergarten. But everywhere he went, he brought out the best in everybody, and he brought a lot of joy to every situation. So over time, we realized we had a very special little boy who had a rare disease, but also some rare gifts that he was sharing with the world. And it was our job to do everything we could to support him. Always knowing that we could lose him at any time. We weren't sure how long we would have him. And certainly in those early years, had no expectation that he lived till 26. Because when he got sick, he got really sick. So it was a process that took time. I'm proud of how our family responded to this challenge, and I'm proud mostly of how Jack responded to the challenge. And he really taught us how to be his parents because of his own attitude. And that was wonderful emotional fuel for me as a dad to give him what he needed. There came a point, David, where I realized that my job as a dad was to give Jack the best life I could, no matter how short a time he'd be with us, because I wanted to be able to look back and not have regrets about the time we did have together. And once I got clear on that, everything got easier, because for Jack, every day was like a party. He was so happy. And so my job was to be happy with him and join the party and appreciate every day that we had with the party, because we didn't know how long it could last. And I feel lucky looking back now that it lasted as long as it did. It was a wonderful 26 years.
So thank you for sharing. Some people might be listening to this conversation and be thinking, well, yeah, well, he has a BS in counseling. He's got a master's from Harvard. He's got a PhD, right? You're way ahead of the curve, right? And the average dad might be. But one of the things I learned about your situation, and no doubt you've been able to rely on your education a little bit, is that you didn't figure this all out on your own, right? There are a lot of people that came through your life, came through Jack's life, right? And what I've heard you say in the past is that you feel an obligation based on those that have leaned into your life to pay it forward. And I'm wondering if you can share an insight or two about that.
Sure. Well, first, I'd like to comment that I appreciate your acknowledgement of my academic credentials, and with no disrespect to any of those institutions or to granting institutions, I really don't think they had all that much to do with how I've approached this situation. We used to call Jack Professor Jack. He's the one that taught me what I needed to learn in order to be a good dad. Professor Jack was my best professor. Certainly the education prior to Jack didn't hurt, but that's not the reason if I'm ahead of the curve, it's because my son was a better professor than most. So he's the person that had the most impact. Others, I mentioned when Jack was diagnosed, other families who were faced with similar challenges were very inspiring to me, and especially adults with this disease whose parents were told the same thing we were inspiring to me, and befriended our family and befriended Jack. And a couple of these women, they were 50-year-old women with this disease, were mentors to me. Everyone comes to Dr. Al for help and support. I went to these two women who lived into their 50s with this disease. They inspired me because their parents were told they wouldn't live past 2 or 5 or 6, and they gave me the message. Don't do to Jack what my dad did with me. He gave up and listened to the doctors and was waiting for me to die my whole life. And my dad's been gone 20 years, and I have a job and a partner and an apartment, and I'm happy. So others who've walked the same trail or or used their wheelchair to get down that trail really inspired me and helped me and made a big impression on me. And other parents who've lost their kids along the way, who were very active in our Cure SMA organization, inspired me too. No matter how hard your life is, there's somebody else whose life is harder. So as Jack got a little older and his needs got more complicated, I looked at the families with the older kids with the tracheotomies and the ventilators, and the families who had lost their kids and they were still walking and talking in sentences, and not only that, but helping all the rest of us. They inspired me. And Jack ultimately needed a ventilator and a trach in his last 6 years or so, and now he's gone too. And hopefully his journey will have helped others to follow, as we all help each other in these situations. So I could go on, but there are a lot of doctors and researchers and teachers and wheelchair repair people, and Jack's Memorial Service, we had so many people who were caregivers and helpers who were part of his life. They inspired me too, because they choose to help us. They choose to get involved. Like, I didn't decide to be the parent of a kid who needed all this stuff, but nurses and doctors and wheelchair repair guys, they make a decision to get involved. They don't have to do that. They can do other things. So the nurse that would spend 12 hours overnight with my son, 12 hours during the day with my son, and they took turns. They chose to get involved and help us. So those types of people also made a big impact on me. And I feel that my job was to be as respectful to them and the situation that I was in as they were in the situation, having chosen to get involved. They didn't have to. So I wanted, as a dad, I've always wanted to rise to the standard of these people who I looked up to, whether other parents who face similar challenges or the healthcare providers who chose to help us.
We're going to move into breakout in a moment here and give the dads who are participating in the conference an opportunity to reflect on the topic, share with one another what their own experiences have been, and to network a little bit. So I just want to say in closing, Al, thank you for your time and many insights. As a reminder, Al is just one of the dads who's part of the Special Fathers Network, a dad-to-dad mentoring program for fathers raising children with special needs. And we hope to have you back again soon.
My honor to be here. Thank you for having me, David. Enjoy the conference.